our speakers for great talks. So we can also get all the speakers on the stage for the discussion panel. But first, I would like to take a moment just to introduce you our funding opportunity whenever our speakers are sitting on the stage. So recently, we just published a funding opportunity, which is Whole Person Research and Coordination Center, and the aim of this funding opportunity to bring all scientific teams with collective backgrounds and experts in physiology, data science, AI, ML, ethics, so which you might be interested in to apply. And also, this funding opportunity aims to build whole person physiome map representing all physiological organ systems, and then build in silico whole person model. If you are really interested in, please reach out to me and my colleague, Dr. Elizabeth Ginexi. Also, there's a QR code in there. We are launching another. We are actually organizing webinar, technical assistance webinar, and also networking webinar. If you are interested in, please register. And for the questions, you can always reach out to me. Thank you very much for your attention. So now with co-chairs and we will actually moderate the session and discussion panel session. So if you have any question, please, yes, Andrew. Yes.
So I have to say one thing since somebody else already started there's a lot of discussion here about data visualization, and I'd really like to encourage the group to think about that more as data representation. Visualization is very limiting in some ways. I cannot see, but I'm a trained bioinformatician and geneticist. And a lot of times with the high-dimensional data sets and tools for visualizing them for folks, my population doesn't recognize. So I'll just put that on there. The screen reader looks at it and says, that's pretty interesting. My question actually is about something that a lot of the speakers touched on, some more directly than others. But a common thread seems to be the question where I have some potentially sensitive features, and I think that they're interesting, and there's something interesting going on in the data, but I also know that they're potentially hiding other variables, other things under them. And a lot of you were talking about different ways that you are trying to tackle that problem of finding what's underneath. And are the barriers for that data access, data interoperability? Are they mathematical, or is it social, something else?
Maybe before you hop in, because it seems to be like you're back. Andrew, thank you for bringing that up. As you came in, I was the one who helped you into the room.
Yes.
And yet still, and no pun intended, I was blind to what you were saying about how important data representation is. And that's scary to me. The same way it's scary that redlining and all this exclusion happens without us understanding. So I really appreciate you bringing that up, and I look forward to chatting with you further about how to implement that. Thank you so much.
And thanks for the second part of the question too. There's this sort of, I think, implicit thought process that we all go through when we choose what data to work with. That sometimes if we are going to use sensitive data or data, for example, that reflects biological sex, or that reflects race, or that reflects other social constructs like ethnicity and others, sexual orientation, that maybe we shouldn't touch that data, or maybe we shouldn't touch these attributes. Maybe there is a lot of social background. Some of it might reflect social injustice that is reflected in these features. And so maybe we shouldn't touch these features. I don't think that is the right approach. I think we should use all of the information that we have available to us. This notion of fairness by omission doesn't really work. Just because we choose not to look at these things, these problems are not going to go away. In fact, it's going to be more complicated because we're going to be, as I was trying to illustrate before, unable to estimate these quantities, unable to control them. So the important thing is to come to as much of a consensus as to what are the right notions of fairness that we should be employing in a specific setting, and then use all these attributes that we have to try to estimate these quantities and gauge these predictors or gauge these estimators for these notions of fairness. So I would just say we need to use this information in as much as we can, and just try to be precise as to what is it that we mean when we say that we would like methods and estimators to be fair.
And just to add to that, based on what he just mentioned, think about a future world where any research we do in the view of transparency will show all of those features. That would be great, right? Because we would know what you did, what you looked at, what you didn't have, and what's missing. Right now, it's Wild Wild West. Everybody goes and does what they want. That's why someone comes up with an AUC of 90%, and you're like, "Whoa, fantastic!" And I look at that, and I'm in infectious disease, and I'm like, I don't see any orientation information. I don't see anything. I don't see how useful it is. So that's why we're here, right? As a field, we all need to come together and have this very frank and sometimes very uncomfortable conversations because we're trying to do the right thing. I doubt if someone is trying to do harm, but we have to be careful.
Hi, Andrew. This is Rina speaking. I just to add on to what the others have said, this is like a phrase I've heard from somebody else whose name is skipping right now, but the phrase was, "There is no such thing as a fair data set, and we can do so much to like uncover as much as possible, but ultimately we're never going to solve the systemic inequalities that are like embedded in the data, that are like embedded in the world, and we can't like fix the world as a bunch of biological computation. This is no offense to anybody here. So I think like the best we can do is like, again, find out what metrics of fairness is relevant for the problem or question we're answering, what metrics of fairness is relevant for the problem we're trying to solve. We can't fix the world, but I guess we can make it, we can solve our problems in a little bit of a better way.
I also, real quick, I feel that it's really important in the studies that I've participated in to having like a very, very strong, whether it be a data dictionary or sort of metadata on your data in order to understand its lineage as well as its provenance. So data lineage, data provenance, data readiness, that whole kind of scope, I think is super important, because then you're able to then follow the trail and kind of piece it together afterwards. So I always encourage everybody to have metadata to your data, and then being able to compare your data sets when you're trying to harmonize them.
That's, yes. Yes, please.
It's kind of a question comment that I would like you all to address. I hear you talking about the data and the data analysis, and I look at mostly where you come from, similar to my background, even though I'm from Puerto Rico, and we are in tertiary care medical centers mostly. And then, because of a personal experience that I had a knee replacement, I chose to go where they had the robot at the university. That happens to be a county hospital, not the tertiary care center. I realized how different the populations are. And yet many times when I look at grant proposal calls, it ends up great clinical trials being convenience samples. Who shows up in the door of the tertiary care medical center, the really fancy centers, mostly people with resources, education, and so on, which is very different from the county hospital, which are all lesser educated, depend on Medicaid, poorer. And so how can, at the policy level, you come in and say, look, I'm going to give you millions of dollars to do this study, to collect this data, but you know what? No, you cannot come in at, the, Harvard, Stanfords of the world. I want you to go to Santa Clara County, San Francisco General, and so on and so forth, because that's where you're going to get representative data. We're looking at some data on knee replacements, and it's very different in the main hospital than in the county hospital. And so what policy levels, what changes would you advocate? Because NIH is paying for the studies, and it's not saying, they say, oh, we want diversity and inclusion, but they're not saying you cannot do convenience sampling on this.
Ooh, that was a good one. I'll start and be quick about it, just because I was furiously typing. It reminds me of that one comment that came to mind during my slide set, which was, is it lack of access or lack of offering? It kind of adds a third kind of column. Like, is it lack of venturing into those domains potentially? I work for the state of Illinois in a fairly senior position, and by introducing terms like redlining, health equity to people in those positions, it then, sort of through diffusion, kind of starts to spread this notion of, oh, maybe we should go to the county hospitals. I myself not only work at the Illinois state, but work with incarcerated populations. I did my residency at Cook County Hospital of ER fame, in Chicago, and the population was incredible when you compared it to the other place. I did a dual residency thing, so I went across the street to Rush Hospital, and it's like a beautiful, we called it Hotel Rush. So, there's Hotel Rush versus the dregs of the county hospital. But having somebody who went through that system, who now has an opportunity to write grants, I can now kind of ask my teams and colleagues to focus on that. So those are, I think it's really just about, as Doc was saying, spreading the word and coming together as a community to affect those changes. So I hear exactly what you're saying, and it's not easy, it's not quick.
It is also practically difficult structurally, because some of the T-level research that is required, there are certain things that have to be in place for it to be done. And some of those county hospitals are just barely doing enough to take care of their populations. So to your point, the field has to demand it. I'm sure NIH is trying their best. I use an example in infectious diseases. They have IDA states where they're looking for states that have not received as much funding as the Stanfords and Harvards and New York, and trying to push it that way. It's just structurally very challenging, but that's where we are right now. But it's a great point.
Excellent panel. I don't know if this is the best place to bring it up, but maybe it is, as a Hispanic and Hispanic community, but I do work on genomics. Self-identification for the Hispanic community is nonsense. It is nonsense, I think, for everybody else, because what you feel and how you self-identify, it's not usually genetically or molecular important. Is there any way that we can try to at least do something about this, like get ancestry with our clinical trials in the area of cancer genomics? That will be very useful, that we could have something else. And it's just so easy now to do it, no? And I don't know if there is any, that's why I bring it here, if there's any ethical or is any concerns about that. If we're asking the patients already to self-identify, I think it's just one step to ask a swab for saliva, and then we deal with their molecular markers, and we don't have to deal with all of these others. And I think for Hispanics, it's also true that we are less homogeneous. And most of the populations that I collaborate with in Chile and such, people is kind of half and half, Spanish and natives and such. So it becomes a little bit more important to have those definitions of those markers and how we tie those markers to somatic mutations and such that are important and relevant for cancer treatment. So I bring it to you. I don't know.
So I probably won't have a completely satisfactory answer, but perhaps I can give you a little bit of insight. So as someone who is Hispanic and Latin American as well, I know very well what you're talking about. It's a very diverse population. This happens not just with the Hispanic population, it also happens with the Asian community. Asian categories in census data, for example, is extremely diverse. Someone who is from the south of India has very little to do genetically with someone who is from the northern part of Mongolia. And so I think what you're asking is a very, very good question that we will have to face in the near distant future. Right now, I think most of the attention, both in the academic world as well as in the policy world, is given these buckets of categories for race, what do we do with them? How do we control for them? When is it appropriate? To what degree? I think that is sort of the most immediate pressing conversation that most of these entities have been maintaining. However, at some point, we do need to tackle the higher level question, which is, I think, what you were bringing up, which is these things are social constructs. Is it adequate to measure disparities among these social constructs that are self-identified, or maybe we should be using other notions of segregation of demographics? I think that's a much harder question. For example, I have an engineering background. I don't feel I'm qualified to sort of to solve that matter. That's a question that should involve public policy experts. It should involve ethicists and the social sciences. It's an excellent question that I think we will have to start addressing very shortly.
Hi, that was an excellent question. And as a Bangladeshi trans person, I have so many thoughts on self-identification. Like I can't tell you like the number of times like I've had been given like equity form to fill out, and they're like, "What is your race, ethnicity? Here are your options: East Asian, Southeast Asian, Indian." I'm like, wait, what? Where am I? Like, where am I? Where's the option that says like Bangladeshi or like South Asian or I don't know anything that like any bucket that I fall into? Like, if you're asking me to fall into a bucket, give me a bucket that fits at least. So, just like okay, my own frustrations aside, like to answer your question, like I think like one really interesting, like I don't have a perfect answer, but one really interesting solution I've seen proposed is from this paper called towards sorry, I forgot, but there's a paper. I know Dr. Alex Hanna is one of the authors, and one thing they propose is having a more multidimensional categorization of race, whereas race is obviously not just one factor. So we could use self-identification, but have that be an open field. People can identify their race in their own language much better than we can in a stratified like bucket. And it's not great for categorization, but it's important. It's important to find the language that people use to identify themselves. And you can supplement that with this like census-based identification. You can supplement that also with like an observed race identification. Like when like some in certain circumstances, especially if you're thinking of profiling, it's also useful to know what an observer sees somebody's race as versus like what they themselves see as. And there's like a bunch of other dimensions proposed in that paper, but I even if like not all of them will be relevant to every situation, I do believe that we need to think of a more multidimensional approach than the single fixed variable that supposedly will help like make our systems more equitable.
I'm also a big fan of adding, as I said many times already, location data, location. That can sometimes give us a little bit of an understanding of the difference between somebody who identifies as Black that lives in inner city Chicago versus somebody who identifies as Black that is in sub-Saharan Africa or something of that nature. So location can also help. And then it escapes me, but I agree. Just layering data on top of each other seems to be the way to go.
I would say the good news is the Europeans are doing this better than we are. They're going very quickly as the European Union, collecting biomarkers, connecting to one EHR system, removing all of these definitions. they are able to do that because they're slightly more homogeneous than we are, but more because they trust their system. Unfortunately, in the US, it's a different model. The communities don't trust. I'm not going to let you swab me because I don't know what you're going to do with that swab in the future. So those are things that underlie some of the challenges we have, but it is something we need to do. Honestly, the concept of race is for our convenience. It's not biological.
That's a great thought. So it might be the next steps to develop. Okay, thank you very much. Oh, one more question. Yes, sure.
Sorry, I'll make this quick. So I'm a PhD student. My name is Jade at the University of Colorado. And I just want to say thank you for all of your talks. I really appreciate you guys being here and the work that you're doing. So I thought of this question during Dr. Montgomery's talk, but I'm interested to hear everyone else's perspective as well. So when we're evaluating in fairness, I'm just wondering if you guys have any experience with looking at like the interactions between different factors or attributes so that we can get a more like intersectional perspective on how they are contributing to the outcomes.
I think the question, if I may rephrase, had to do with addressing notions of bias and fairness in cases where there is intersections between different demographic groups, such as sexual orientation, but also race, but also ethnicity.
I don't have an answer to.
The one perhaps thought or comment I can contribute with is that when I was mentioning before that in the sort of technical statistics literature, there's a notion there's a variety of notions of what it means to be fair for a predictive algorithm. Most of these things look at demographic groups that have a specific dimension. More recently, and when I say recently, I'm talking about the last 2 or 3 years, some of these notions have been extended to newer, sort of slightly more sophisticated ways that allow you to control for fairness in specific ways, accounting for intersectionality. I'm happy to talk more offline and point you to some of those works as well.
I want to learn them too.
Okay.
There may be Zoom meeting.
Very briefly, the work that I'm actually doing that I didn't really talk about too much on the geospatial information, I think kind of pulls a little bit of that in because you have like very heterogeneous like populations living. Specifically, I'm looking at what the health outcomes are for and health utilization is in and around prison towns. So looking at the geographic area closer to a prison, and those can be very diverse, white security guards, Black families living near a predominantly minority housing, correctional institution. There's a lot there. So that's actually something that I'm trying to tease apart, and I might be chatting with you.
So just as a quick pointer, you can look at these notions called multi-accuracy and multi-calibration. Basically require certain notions of calibration across groups, and there are ways to controlling for them uniformly. There is very nice work coming out of University of Pennsylvania by Aaron Roth's group that you can look at. It's cool stuff.
Cool.
Cool, great. Thank you. I think we are out of time, but thank you very much for your questions and great panel discussion. And if you have more questions, please reach out to us and our speakers. Thank you. Enjoy the rest of the session.